The Crono LECIG pump delivers levodopa, carbidopa, entacapone. It's used for patients with advanced Parkinson's disease who have severe motor fluctuations and dyskinesia.
LECIG gel, please note that the brand name might be different in your country, is delivered directly into the intestine using a gastrojejunostomy tube, called a PEGJ tube. The PEGJ tube is inserted through the abdominal wall and passes through the stomach into the small intestine. The medication, LECIG, is contained in a cartridge that is connected to the pump. The pump allows LECIG to be delivered regularly and continuously directly into the intestine.
A test is first performed in a hospital via a nasogastric tube to determine the effectiveness of the drug. After successful testing, the PEGJ tube is placed. The pump is programmed in milliliters per hour. Up to 3 different flow rates can be programmed. You can choose the continuous rate during the day, and a morning dose can be programmed independently of the bolus.
To prepare the pump, you will need the Crono LECIG pump, 50 ml cartridge containing 20 mg per milliliter levodopa, 5 mg per milliliter carbidopa, and 20 mg per milliliter entacapone, as well as hand and skin disinfectants.
The cartridge needs to be stored in a fridge at 2 to 8 degrees Celsius, protected from light. It can be used for up to 24 hours after removal from the fridge.
To prepare the pump, place the cartridge upright onto the pump. Turn the cartridge until it clicks into place. Remove the plastic cover cap and unscrew the purple cap of the PEGJ probe. Connect the cartridge to the intestinal axis, marked with I, of the Y adapter. Hold the Y adapter of the probe with one hand and carefully screw the cartridge and the pump onto the Y adapter with the other hand in a clockwise direction. To turn on the display, press any key on the pump. To turn on the pump, press and hold the on-off button. Press and hold the droplet button. Use the down arrow key to select morning dose from the menu. Press and hold the droplet button. The pump will now deliver the morning dose.
After the morning dose has been administered, the pump automatically switches to the continuous dose for the rest of the day. During the day, the patient can administer a bolus by pressing the droplet button. Put the pump in a carrying bag to wear it comfortably over the day. The pump can be worn for up to 16 hours.
To remove the pump in the evening, turn the display on by pressing any key. Press and hold the on-off key. The pump display will say Stop. Press the OK button to stop the infusion. Unscrew the cartridge from the intestinal tube and close the tube with the purple cap. Make sure you don't turn the PEG probe to avoid accidentally pulling the probe out. Press any key to turn on the display. Press and hold the OK key. The display shows the main menu. Press the lower arrow key and select End. Press OK to confirm. After 10 seconds, the piston is retracted.
This process takes approximately 6 minutes. While you are waiting for the piston to be fully retracted, complete the following steps to flush the probe.
Fill 2 20 ml ENFit syringes with tap water and have the adapter for the gastric axis ready. Open the intestinal port. Insert the syringe and press the plunger with constant, moderate downward pressure to flush the probe. After flushing, remove the syringe and close the intestinal connection. Now place the adapter for the stomach port onto the other syringe. Open the stomach port, insert the second syringe and press the plunger with constant moderate pressure to flush the probe. After rinsing, remove the syringe and close the stomach port. As soon as the plunger is completely removed, the display shows display off. The pump switches off automatically. Now remove the cartridge by unscrewing it. A similar therapy is the Duodopa pump with levodopa, carbidopa, intestinal gel. The dosage is the same, but entacapone is not included in the medications.
The patient first undergoes the same procedure via a nasogastric tube to determine the effectiveness of the drug. After successful testing, a PEGJ tube is placed. So similar to the Crono LECIG pump, the administration is via a PEGJ tube.
The Duodopa system includes a pump connected to a cassette with levodopa 20 mg per milliliter and carbidopa 5 mg per milliliter and PEGJ tube. The PEGJ tube is inserted into the small intestine.
The treatment is used for up to 16 hours every day, while the patient is awake. The Duodopa pump is a little heavier and bigger than the Crono LECIG pump, and it does not contain entacapone.
In the morning, you need to connect a new cassette to the pump and use a coin to lock it on the side. Remove the red protection cap from the cassette tube and open all tube clamps. Connect the cassette tube to the PEGJ intestinal port connector. Make sure to twist the cassette tube rather than the PEGJ tube. Press and hold the on-off button for 3 seconds until it turns on. Press and hold the start-stop button for 3 seconds until the text "Run" is shown on the display. This indicates that the pump is running. Press the morning dose button twice to administer the morning dose. After finishing the morning dose, the continuous infusion will start automatically. In the evening, stop the infusion by pressing and holding the start-stop button for 3 seconds. Next, press and hold the on-off button for 3 seconds to turn the pump off. Disconnect the cassette tube from the PEGJ intestinal port connector. Again, make sure to twist the cassette tube rather than the PEGJ tube. Then, disconnect the cassette from the pump. Connect the blue connector to the intestinal tube port of the PEGJ tube. Using a flushing syringe, flush the tube with at least 40 ml of drinking water.
Make sure you also flush the short PEGJ tube with about 40 ml at least once a week. Always close the lid after washing and throw away the used cassette.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.